Everyone, it's Sheena here with Uncommon Sense Investing, here to answer another frequently asked question. Thanks for tuning in. And today, the question is, what are my health insurance options before Medicare? The truth is, many people retire before the age of 65, and healthcare costs and insurance is a huge aspect of that planning. So let's dive in here. Listed are several common health insurance options to help close that gap. COBRA, the ACA Marketplace, or also known as Healthcare.gov, and traditional employer insurance, either through a spouse or even part-time work. And last listed there is cost-sharing options or healthcare ministries. Cost-sharing options and healthcare ministries is technically not insurance. It's a group that comes together, they contribute funds into the group, and it helps assist that group in paying their healthcare costs. So it's definitely an alternative choice. And so I'm not going to focus on that one today. We're going to talk about the first four listed. COBRA. What is COBRA? COBRA allows you to keep your employer health insurance for 18 to 36 months after you leave your job. So it's great. You get to just continue on with that coverage. It's simple and easy. You get to stick with your same doctors. You get to stay within the same network. And it's great for people who have some ongoing medical issues. They just get to stick with their plan. But it is expensive because you're no longer only paying your employee portion of that premium. You now also have to pay the employer portion plus a small administrative fee. So it can be one of the more expensive options, but it is nice for people who maybe just need to have it for a short amount of time before they select Medicare and switch on to that plan, and for people who are willing to pay the higher price to just stick with a familiar plan. So COBRA is great for some situations. ACA Marketplace or Healthcare.gov. This is the option that I help people navigate the most. It is a great solution. It's health insurance that's purchased on the federal exchange, at least here in the state of Wisconsin. Some states have their own marketplace and their own exchange, but in Wisconsin, we use the federal system. So it's popular because, well, sometimes you can get premium subsidies depending on your income level. So it can be the most cost-effective option if you can keep that income below certain thresholds and, enjoy some of that sharing. Also, anyone can jump on a plan. You cannot be denied for any pre-existing conditions. The way that you can navigate and shop the marketplace is to contact a healthcare or a health insurance agent. They'll help you do that and walk you right through it. Or you can go to an organization called Covering Wisconsin, where they have assisters and navigators to help walk you through that. So there is a lot of help out there when you're looking around and shopping on Healthcare.gov. Traditional employer insurance. If you are married and your spouse is still working, you might be able to go onto their employer insurance plan. That's a very simple and easy choice if that's available to you, or potentially part-time employment. If you're someone who is gradually moving into retirement and you want to continue to work before you're fully retired, it's possible you might want to seek an employer that offers that benefit to you. So this is stable. It can be cost-effective and easy. So in a nutshell, health insurance, it is a hurdle, yes, but you can often get over it. It can seem daunting, but there are people out there to help walk you through it and figure out that aspect of retirement, including us. It's part of the retirement plan, and I hope that this has educated you on what those options are, and I appreciate you tuning in. Thank you.